According to the Association of Kenya Insurers (AKI), drugs make up an average of about 45% of a patient's hospital bills. This cost is attributed to the high cost of branded drugs deemed to be more effective than the generic drugs.
And the difference that maybe people need to understand, number one, is the branded and the generic drugs work just as well. And when you look at the cost of the generic will be up to 20% cheaper.
Industry players now calling for a legal framework that will see stakeholders in the health sector increase the use of generic drugs and only resort for branded drugs when there is no option for generic. If the use of generic drugs is increased, then Kenya will be following in the footsteps of countries such as India and the United States of America that have implemented similar health policies.
Recently, we heard from India. They are actually coming up with a law to make sure that all doctors prescribe generics. US, 89% of all prescriptions done there are actually for the generics.
According to the 2015 industry report by IRA, 10 out of 20 companies offering medical covers reported underwriting losses in this category. The use of branded drugs in Kenya currently stands at an estimated 80%, but industry experts reckon that this can be reduced by almost half through increased use of generics. Dennis Otieno, JKL.